Hello, my name is Marianne, and I'm a family support and addiction counselor at the Vita Nova Foundation.
Hi there, my name is Sal, and I'm a peer support worker at Vita Nova, and I co-facilitate the weekly family support meetings. When someone you love has an addiction, the entire family is affected. Parents, spouses, and siblings alike. Addiction is a human condition with human consequences, and that makes us all vulnerable. Addiction affects everyone. It strains relationships, it can cause physical and emotional abuse, as well as cause financial hardships for the entire family. It can be devastating. We often feel hopeless and unsure about what to do. We blame ourselves, and the guilt, shame, and helplessness we feel can be overwhelming. This is where Vita Nova can help.
Family support is available to anyone who wants the help, whether or not your loved one is already getting treatment or has yet to seek help. By participating in the family support program, you will learn how to deal with individuals who continue to use drugs. You will learn how to support those who are participating in recovery programs, as well as being able to help yourself.
In this video, you will be introduced to strategies on how to better manage the challenges caused by addiction. We have developed a compilation of strategies and techniques, which we call our Toolbox. The tools which make up our toolbox help family members deal with addiction. We learn about changing our behaviors, maintaining our own well-being, and how to truly help our loved ones succeed while on their journey to recovery. As our loved ones begin to heal and learn to change their behaviors, we too must change our behaviors, as the journey to recovery is mutually inclusive. This is where the Toolbox can provide you with the help and guidance you need. You will hear about which strategies have worked for others and which ones have been less effective. For you, it will depend on your personal situation and how much of a change you are willing to make. The more you practice them, the easier it will become to use them. Using them will help you make your life more manageable. One saying that is often repeated in our family support group is that nothing changes if nothing changes. Simply put, your loved one has no reason to change their behaviors if you don't change yours.
So what's in the toolbox? The toolbox contains about 24 strategies and techniques that you can begin to implement almost immediately. We recommend that family members keep them handy, keep them visible, and readily available for when you need them. Keeping these tools present and trusting in their effectiveness will help you and your loved ones. While we will be presenting them here to you today and expanding upon some, you will have access through a link at the end of this video to the complete toolbox that will include full explanations.
Let's introduce the tools from our toolbox. Let me start by stating that research has shown that addiction often stems from some sort of trauma, usually experienced from early childhood. That results in feelings of disconnection and suffering from attachment issues. How can you address this? What should you do to avoid these triggers? You can use the following tools. Give unconditional love. Provide positive support. Give affirmations. Forgive. Let's highlight two key tools from our toolbox.
Give unconditional love. This is letting them know that despite the fact that you don't condone or support their behaviors, you do and always will love and support them as a person. By separating the actions from the person, you are helping them to see that they are not their addiction. This also helps to put it into perspective for yourself as well, by removing the confusion you may feel. For example, how can I still love someone that steals from me to buy drugs? Reframe this sentence to, I love my son, but I don't like that he steals from me to buy drugs. That puts the focus on the action and not on the person. Forgive. To forgive someone doesn't mean that you forget the action, nor does it absolve them from responsibility for what has transpired. What it does is give you the ability to release those painful, hurtful feelings that you continue to hold on to that keep you stuck in a place of despair. The more we hold on to these negative emotions, the harder it is for us to move forward and to live the life we deserve. You're not doing it for them, you're doing it for yourself.
When it comes to communicating with your loved one, you're often responding to the person you remember, not the one under any influence, when in reality, you're dealing with the person suffering from addiction. We fall for their manipulations, their lies, and their betrayals. The sooner we accept the reality, the sooner we can start helping the person we love and that we remember. This means responding differently, stepping back, being truthful, no matter how heartbreaking it may feel, because defending or questioning the addicted person will result in arguments and be upsetting for everyone involved. To address this, we suggest using these tools. Communicate. Choose to respond differently. Don't talk, listen. Stare. Step back. Act and resolve quickly. Ask the question. Be truthful. Let's review a few of these significant tools to help with communications.
Choose to respond differently. By now, I'm sure you've realized that yelling, screaming, and crying all have little effect on your loved one's substance use. That's not because they don't care that they're hurting you, because they know they are. A large part of what addiction is and how it develops is about the individual wanting to numb the pain. It's about them not wanting to feel, because when they do, they're so filled with guilt and shame that they can't bear the weight of those emotions. Therefore, they use substances so they don't have to continue to feel that way. Gabor Mate, a renowned Canadian doctor who specializes in addiction, says, "Don't ask why the addiction, ask why the pain." One technique you can use to respond differently is positive reinforcement. Most people who use substances are looking for attention and will behave in ways that will provoke a response from you. Any response, whether it's a negative or a positive, doesn't often matter. So instead of responding to the negative behavior that you don't want them to continue, like substance use, try responding with positive reinforcement to the non-using behaviors that you do want them to continue. For example, if you share a good conversation with them when they're not high, let them know how much you enjoyed it and that you hope that you can talk like that again soon. Then stop responding to the behaviors that you don't want them to continue, like when they come home drunk or high. Remove yourself from them so you aren't providing them with the attention that they so often seek. The hope here is that they will try to continue to gain your attention by doing more of the positive behaviors that you are responding to.
Stare. Stop. Think. Assess. Reset. Engage. Stop yourself from the impulse to respond or react immediately out of anger, frustration, or desperation. Give yourself the time and the opportunity to think things through, clearly and rationally. Even seek out help from others. Assess the situation or the problem. See it for what it truly is, looking past the manipulations and the lies. Reset your intentions and plan your course of action, and when you're ready to engage, engage. Stare. Stop. Think. Assess. Reset. Engage.
Don't talk, listen. The Dalai Lama has been quoted as saying, "When you talk, you're only repeating what you already know. But if you listen, you may learn something new." Very often we are so intent on being heard or getting our point across that we fail to really hear what the other person is trying to say. We often just listen enough to formulate our own response and not really listening. Only when we truly listen to what the other person is saying with no thought to our own reply can we really hear them. Listen to what your loved one is telling you, even if it's difficult to hear. Only then can you respond honestly and openly.
You will learn that there is a different way to love someone suffering from addiction, because you don't want to support the addiction. You want to set boundaries that will help derail the addiction and support the recovery. Boundaries are important for both of you. Set your boundaries lovingly and as often as you need, and be clear about the consequences of violating those boundaries. And follow through, no matter how cruel it may feel. Your loved one is responsible for themselves, and we can't solve their problems. If they aren't willing to change, the choice is theirs. Remember, enabling supports the addiction, and helping supports the person. These tools will help. Love them to live. Do not enable. Set boundaries. It's okay to say no. Follow through. Detach yourself. Don't blame yourself. Be on the same page. Let us review a few more tools that can help with helping your loved ones.
setting boundaries. We can so easily get caught up in the chaos that is addiction that we find ourselves becoming enmeshed in the turmoil of the substance user. This becomes increasingly unhealthy for us and for them. To combat this, as a family member, you will need to start to set boundaries for yourself. We don't set boundaries to punish the other person or to hurt them. We set boundaries so that we can stop them from hurting us and to protect ourselves and our health and well-being. Sometimes setting boundaries can be painful, so you need to take the time to become more self-aware and to truly begin to practice some self-love. Now, we can't tell you what those boundaries should be, as that is something you will have to discover for yourself. However, we can help you by setting out some guidelines. Start by asking yourself, what behaviors from others are you willing to accept and what behaviors can you not? Once you've established your parameters of your boundaries, have an open and honest conversation with your loved one and clearly articulate what your boundaries are, and more importantly, what the consequences are to crossing those boundaries. Your boundaries may start out simple, but the more you practice at keeping them in place, you gain more confidence in your ability to hold your line. You can then strengthen them. The next step can be challenging, but is so important to keeping your boundaries in place, and that is to follow through. Whatever the consequences you've communicated when you set your boundary, you need to follow through with. Otherwise, the other person will continue to hurt you. Following through is probably the most difficult part of setting and keeping your boundaries. It can help to rephrase the consequences as a choice that your loved one has made. You provided them all the information they needed to make a choice. These are my boundaries, and if you choose to cross them, then you are choosing the consequence instead of continuing our relationship as it is. Please see the link for a worksheet to help you in creating your boundaries.
Do not enable. Enabling supports the addiction, and helping supports the person. When you enable, you are making it easier for them to continue what they're doing. They have no reason to change. When you do something that makes their addictive behavior easier or protect them from the pain of their addiction, are you really helping them? No, you're not. By not having to face the consequences of their actions, not experiencing the ramifications of the things they do, they are free to continue to use. There's no downside for them because you're always there to pick up the pieces or to clean up the mess. Sometimes the only way they can see how far they've fallen is for you to actually allow them to fall. This is not easy to do, as it goes against our instinct to protect our loved ones. However, it actually ends up doing the exact opposite. This isn't easy to do, but it's necessary for change to start happening. It is also our responsibility to identify our needs and to fulfill them. Self-love is a necessity, otherwise you will be drained and damaged, emotionally, physically, and spiritually. You need to be whole and ready for your loved ones. Be ready for when they reach out to you, asking you for help. No matter how dire your situation, maintain an attitude of gratitude and count your blessings. You can't change the past. It's already happened, and tomorrow hasn't happened yet. So you should try not to worry about it. It's an understanding of what you can control and what you cannot, which will help you manage your anxiety. To help, you should use these tools. Take care of yourself, be grateful, stay in the present, stay calm, let go, let God, and say the Serenity Prayer. Let us review a few more of these key tools that can help you.
Take care of yourself. The need for self-care is vital. You aren't any good to anyone if you're not well yourself. So we need to start thinking about putting ourselves first. I know this sounds counterintuitive, but nothing positive will happen if your tank is empty. Stay in the present. Concentrating on the here and now, not looking too far ahead or too far behind, will help to keep you in the moment and able to utilize some of the other tools we've presented here.
And recite the Serenity Prayer. God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. You will soon understand that the road to recovery cannot be rushed. It's a marathon race with few shortcuts. Go for progress, not perfection. There will be steps forward and steps backwards, but that doesn't mean failure. Recovery has its ups and downs. It's a process. These tools are here to remind us of this. Take it one day at a time. Accept the journey.
Accepting the journey is an important concept to understand when dealing with a loved one with an addiction. Whether they are currently seeking treatment, been in treatment before but are struggling right now, or are in active addiction, is that recovery is not about going from point A to point B, but rather a journey that will have many ups and downs, good periods and not so good periods. How you handle those ups and downs could have significant impact on both your well-being and on your loved ones. Acceptance of the journey is recognizing that this is the case. If every time your loved one is struggling, you bring down the hammer and start blaming and shaming again, chances are they will see this as an excuse to revert back to old behaviors to cope. However, instead, if you are understanding and supportive, acknowledging that it is indeed a journey, they're often able to feel that support and it helps them to stay on track. And by you accepting the journey and understanding that this is a normal part of the process, your own anxiety levels will remain manageable.
Remember, the road to recovery is mutually inclusive. It includes everyone. And these strategies, actions, and behaviors, which we call tools, will provide for an environment where healing can begin and be sustained. However, as we introduce these tools, keep in mind that they are intended to be used because nothing changes if nothing changes.
Thank you.
you.